So next we are going to have a not very different session that's still in the topic of policy, and that is biosafety and biosecurity law and regulation case of Africa, which will be facilitated by Dr. Robert Kibuuka, the project coordinator of the SynBio Africa Global Catastrophic Biological Risks Initiative. He's a biosafety and biosecurity expert. I introduced him extensively today, so today I'll just ask him to come and take on his session.
And my topic is biosafety and biosecurity, laws and regulations, case of Africa. I cannot know everything in Africa in as far as that topic is concerned, but I'll give, what I know specifically Uganda, and then we reflect on what happens in our respective countries. So I want to show you the content outline. I'll have the objective of this session, the outcomes of the session, the content, which includes some key terms, and I'll somehow introduce you to, I don't know if some of you have come across it, ISO 35001 of 2019, very current, and then several other regulatory frameworks and other. Then I'll have a summary and references. So that is our objective, to help the participants understand the status and implementation of biosafety and biosecurity in Africa, in conjunction with the national laws, regulations, standards, and guidelines. So that's the objective. And then I have the outcomes here listed. That by the end of this presentation, you should be able to appreciate the role of regulatory frameworks in defining the context in which biosafety and biosecurity activities should be executed. List the key national and institutional regulatory frameworks relevant to biosafety and biosecurity. Make comparisons between the various key frameworks, demonstrating how they reinforce one another, and then link the requirements of the key frameworks to routine activities in their various contexts. So I hope I'm okay here with the Bloom's taxonomy. We went through the Bloom's taxonomy yesterday. I hope I'm yeah. So just to help us now understand what we are going to go through, I have the definitions here of biosafety and biosecurity. So biosafety means practices and controls that reduce the risk of unintentional exposure or release of biological materials. So that is the definition, and the key word here is unintentional. It's an intentional exposure. Then it is, I got it from ISO 35001, and that clause. Biosecurity These are practices and controls that reduce the risk of loss, theft, misuse, diversion of, or intentional unauthorized release of the biological materials. So those are the definitions. Then I wanted to give a practical example here to demonstrate what biosafety is, and I'll read it. A laboratory technician has just prepared a culture of Mycobacterium tuberculosis in order to conduct a drug sensitivity test. He is wearing gloves, a surgical mask, and a lab coat, and is using a biosafety cabinet which has not been certified in 4 years. You see that? The biosafety cabinet has not been certified in 4 years. What does that mean? So, what are the questions here? The questions are, what is the hazard in this scenario? You see, with biosafety, we talk about the hazards. You'll see what we talk about when we come to biosecurity. We talk about here, what is the likelihood of exposure to these organisms, and what are the consequences of exposure? So this was unintentional release of the microorganisms. So here, the person is wearing the gloves, the surgical mask, and the lab coat. Who does this protect? Himself alone, but does not protect others who are, the environment and others who are around him. See? And this is the least effective. If you can see, the use of PPEs is the least effective in the hierarchy of the controls. And the safety cabinet, where does it fall? Which is faulty? Which has not even been certified for the last what? 4 years. That falls under the engineering what? The engineering controls. So, you see, this is where now the problem is. You see, this is unintentional exposure. The person didn't know. So whose role was it supposed to be to make sure that this safety cabinet functions? So we shall see more when it comes to roles and responsibilities under the ISO 35001, because it outlines the processes and procedures through it. And then an example of biosecurity. Winnie is not here. I used her name. I wanted to ask for permission. Winnie discovers her culture of Mycobacterium tuberculosis extremely drug resistant. Yeah. Meanwhile, a local animal rights group has you see, in biosecurity, that is the language, has threatened to disrupt laboratory operations and generate publicity by breaking in and steal. You see, steal. That is theft, stealing the agents. They believe taking samples of this extremely drug resistant will generate most publicity. You see? So here, the question is, what is the threat in the scenario? So we talk about threats. What's the likelihood of theft? Because security, you don't want people to access, you see, this, whatever. And what are the consequences if theft takes place of that material? You understand? So that's the difference between biosecurity and biosafety. So these are other terms, standards, regulations, which you read, legal requirements, and all that. So now getting into the subject matter. As for the introduction, the risk of unintentional exposure to or intentional release of pathogens and toxins and associated research-related information has been recognized globally. And to address this risk, a number of regulatory frameworks have been developed at the international, regional, national, and institutional levels in the 21st and the 20th and the 21st century. It is important to comply with these regulations. And these regulations are under three different levels. We have the international laws and regulations, we have the national laws and regulations, and we can have agency policies and regulations. So, when we are doing all these at our local levels, we have some guiding documents. We have, for example, the international legal frameworks and guidance, guidance principles. For example, we have the BWC, the Biological Weapons Convention. I think you've heard about that, BWC. We have the UN Security Council Resolution 1540. You've heard about that. What level of implementation are these? We have the IHR 2005. A lot of people know something about this. And then we have the international guidance, for example, the WHO Laboratory Biorisk Management Manual, which are available. And then we have the international standards or consensus agreements, ISO 35001 of 2019. Has anybody come across this? ISO 35001? How about the CWA 15793? We've had. But CWA has been retired. But you realize that a lot of what is here is in the 35001. So these are the documents that help us to come up with several of our laws, regulations, and all that, and then the policies. Yeah. For example, the 35001 is just a guiding document. It's not that it's a must that it has to be implemented by government. So, what is this ISO 35001? I told you I'm going to bore a bit with this because it forms a basis for what we are discussing. So it's a biorisk management system built on the concept of continuous improvement. This is what it involves. It involves you plan, you do, you check, and then act. So what do we do in planning? We need to establish the objectives, the programs, and the processes. This is the beginning point that will give us the rest of that. You understand? This is where we need even to clearly understand to anticipate what the problems could be as far as the hazard is. And then we need to implement the processes as planned, you see. And then these processes must be monitored for compliance. But if there is any problem, you take actions. You take what? Action for continual what? Improvement. Yeah? So this is the PDCA cycle. Plan, do, check, act cycle. Briefly about this, I've already said it was originated from the CWA. The same workshop agreement 15793 of 2011, but we also had the 2008, those who have been following. So it uses the PDCA model and the AMP management systems approach. What is AMP? Good, and performance. So it's the first internationally recognized management standard to address hazards associated with laboratories where biological materials are handled at all containment levels. It sets out requirements for a management system to enable organizations to effectively identify, monitor, and control risks associated with laboratory biosafety and biosecurity. You see? It's a very, very important document. I don't know if anybody has come across it, because it's not easy, it's not online. You just have to buy it. Somebody bought it for me, and I have a copy, so I'm very lucky. It also provides a structured approach to manage a risk associated with people, facilities, and working procedures within the laboratory environment. So this is what I mean by, you see, when I talk about biorisk management, you'll say I'll be interchanging biosafety, biosecurity. But when I use biorisk, then I'm referring to both. So this is the AMP model: assessment, mitigation, and performance, which is also linked with the Plan, Do, Check Act for purposes of continuous improvement. Just a definition of a biorisk assessment. It's a process of identifying the hazards and evaluating the risks associated with biological agents and toxins, taking into account the adequacy of any existing controls, and deciding whether or not the risks are acceptable or unacceptable. So this is very critical wherever we are starting any activity involving any biological organism. We must understand that organism and put in place the right control measures. So it is this that's going to define the mitigation measures going forward. And then performance also of the mitigation measures must be evaluated for efficiency. So the measurements, whatever, which must be followed. So this, where does this come from? This comes from our risk assessment, the product of our risk assessment process. And it comes right from the hazard identification, risk characterization. That's where this one comes from, risk characterization. And then after risk characterization, you need to determine whether the risk is acceptable. Then you move forward. If it's unacceptable, then you look for the mitigation measures, and then the cycle continues. So when you do your risk characterization, you will end up with something like this: likelihood versus consequences, and then you have the risk is low, either a moderate or high. So the mitigation measures here will be totally different depending on the risks that you have identified. Are we together? Thus far? So with this ISO 35001, it emphasizes leadership. Leadership is key in the management of hazards within any facility. And it emphasizes the critical role of top management. Why? They are the ones with the ultimate responsibility of the organization biorisk management system. Why? Because they set policy and they also provide resources for the implementation of the what? Of the risk management system, the biorisk management system. They also have the senior management in that, who are responsible for overseeing the biorisk management and ensuring implementation of the operation function of the biorisk management system. I'm taking you through this because it's very, very important. They also have the scientific management. They also have the biorisk management committee, which is multidisciplinary, depending on the activities that are being carried out by the facility. So that's why I've ended the ISO 35001. And now I'm getting into the national frameworks, laws, acts, and policies that impact biosafety and biosecurity. But this will now be Ugandan based, just showing you how Uganda is working on this. These are laws, regulatory framework, responsible authority, as far as the laws are concerned. We have the Animal Diseases Act, how all domiciled in the midst of agriculture and industry and fisheries. So what you need to note here is how scattered these laws are and what challenge does it give to implementation of these laws. The Public Health Act, the Plant Protection Act, the Penal Code Act, National Environment Act, Water Act, Anti-Terrorism Act, Directorate of Public Prosecution, the East African Community Customs Management Act, Occupational Safety and Health Act, Ministry of Gender, Labor and Social Development, Occupational Safety and Health Act. This is where it is domiciled. Okay. We have the Uganda, we have the guidelines here, which were developed also. The Uganda National Laboratory Biosafety Manual. This is the responsible authority. The National Health Laboratory and Diagnostic Services. You have the guidelines for Uganda National Health Laboratory Hub and Sample Transportation. The National Health Laboratory Waste Management Guidelines. The National Research Biobanking Guidelines under the Uganda National Council of Science and Technology. The Standard Operating Procedures for institutions, for institutional biosafety committees in Uganda. It's under the Uganda National Council of Science and Technology. So some key aspects under these laws, for example, the Animal Diseases Act, it requires diseased animals to be separated and reported, and also says that the minister has the powers. So you can see the key aspects of these. The Public Health Act has provisions for the prevention and suppression of infectious diseases. The the Plant Protection Act regulates the importation and exportation of plants, soil, and creates offense of release of pests and diseases. I don't want to go through all, but just giving you an example of what is going on here. There's also an anti-terrorism law here, targets people that engage in or carry out any acts of terrorism. The Act defines an act of terrorism as the manufacture, delivery, placement, discharge, or deterioration of any detonation of any explosive or lethal device in a place of public use or state or government facility with the intent to cause death or serious bodily harm or extensive destruction. That's the Anti-Terrorism Act. Still, something like what I've been discussing, I can't go, because of time, I may not go through all that. But when you get the slides, then you can go through. So here, I wanted to compare what we do here. And I think, is it Susan Kropp also talked about this? For example, in the US, somebody has already defined the select agents. They have what we call the National Select Agents Registry, which oversees the activities of possession of biological agents and toxins and have the potential of severe threat to public animal and plant health. You see, for us, we have scattered these roles and responsibilities, but here they have an overarching law. So I think when it comes to implementation, things becomes very easy. They have the Public Health Security and Bioterrorism Preparedness and Response Act of 2002, which mandates the Department of Health establish and regulate a list of biological agents and toxins that have potential to pose severe threat to public health and safety. They also have the Agricultural Bioterrorism Protection Act, which mandates the Department of Agriculture to establish and regulate a list of biological agents that have the potential to pose a severe threat to animal health, safety, plant health, and safety, or to safety of animals or plant products. Also, CDC and Animal and Plant Health Inspection Service share responsibility for some agents because they potentially threaten both humans and animals. The overlap agents. So how are we doing? Generally, biosafety and biosecurity, I think it's still at really a formative stage. Where are we? You know where we are. Yeah? And we discussed this yesterday, that it's only being discussed under the GMO. Yeah? We are still struggling to have these bills and policies passed. See, despite this problem we have, we don't have the biosafety and biosecurity policy in place. You see, I think this partly explains why we are doing so badly when it comes to preparedness. We have what we call the Biological Weapons and Toxin Convention, which I talked about in my first slides, and then the UN Security Council resolutions, 1540. I don't know how we are doing in the implementation of these. I think we shall get to know. And most importantly, that all states have the obligation to prevent and prohibit proliferation of what? Biological weapons as state party to the Biological Weapons Convention and as a member of the United Nations. So, what is this Biological Weapons Convention? This one prohibits countries that have signed the treaty from developing, producing, stockpiling, acquiring, or retaining biological agents or toxins of types and quantities that have no jurisdiction for protective, defensive, or other peaceful purposes. The treaty also bans any equipment or means of delivery that is designed to use biological agents or toxin for hostile purposes or armed conflict. Then this is the UN Security Council Resolution 1540 with 3 primary obligations, which you will read also. So, where are our issues in all these? Where do we stand if you compare us to other countries which have already implemented better biosecurity and biosafety requirements? Is there a problem of lack of awareness at the highest level? Scientists, maybe we've not done enough to sensitize these people. We don't have enough resources that is required. For example, how many BSL forces that we have in Africa? How many do we have? And how many do we have? Does the US have? for example. We have how many? Yes. We have only 3. Yes. Yes. Where? Where? Worldwide. But how about in the US? How many do we have?
I think it was more than 5 or 6.
No, they are more than.
No, not as you imagine. No. Being in 4 is very, very expensive.
Yes.
So, 4 in the US, 3 in the UK. Yeah.
Only 4 in the US and 3 in the UK.
Yeah. And for the Arab countries, only the Arab countries, and only the Middle East countries is Saudi Arabia. And to surprise me to know that. Saudi Arabia is the only Arab country has the East
Saudi Arabia.
one.
Yes.
Saudi Arabia? No. And then Africa? Gabon? Cote d'Ivoire? And South Africa.
Cote d'Ivoire have
Yeah.
So you see? Do we have the sufficient technical expertise to detect pathogens? That one also is another one. Financial resources. But there is some hope with the international partnerships. Are encouraging laboratory programs to establish and maintain laboratory quality systems. The WHO accreditation and surveillance systems, the clinical laboratory improvement amendments of, yes, the ISO, these ISOs and this one. The international health regulations. These are an international legal instrument that is binding on 194 countries across the globe, including all member states of the World Health Organization. And the IHR requires that all countries can detect, assess, respond, report, and respond. So there is a lot of work going on around here to make sure that these are achieved. You never know, Uganda might have a BSL-4 in the future because we are a hotspot for, the emerging pandemic threats. It could be a regional lab, you understand? We have DRC, where we have all these coming up. Yeah. You have the global health security agenda with a vision, a world safe and secure from global health threats posed by infectious diseases. I think we're also all aware of this, isn't it, colleagues? It was launched in February 2014. Yeah? And we had a big meeting here in 2017 in Uganda. Yeah? The Kampala Declaration. And you have all come across these action packages under the Global Health Security Agenda, and they are being supported around the world. Prevent, detect, and respond. I've participated very actively in Action Package Prevent 3, which is on promoting what? National biosecurity and biosafety systems. I think many of you have participated in these meetings. You have also done the joint external evaluations in your countries. Yeah? And what are these JEEs? It's a process that allows an external assessment of the country's capability and the capacity to deliver the core capacities outlined in the IHR, in the International Health Regulation. And that is detect, assess, report, and respond. You know the gaps. Within this, you get to know where the gaps are and try to work on those gaps in your respective countries. This is a map of 2018 showing which countries have either completed or which are in progress with the AG, the joint external evaluations. Is Egypt done with that? Yeah. With the Tunisia? You know, my eyes can't read this properly. What is there? You did 2016? And you applied for? I think we're going to discuss. You want to go back?
What the color coding you mean?
Ah, you can read here.
It's so small.
Hey, so small for me.
So
This actually green, these ones are the ones which have completed.
yes, and then
The green.
What about the yellow and blue?
Yellow, what is there? Ian?
yellow they have planned to conduct.
So the evaluating the plans and the blue is the
The blue. Yes?
I want to know some green that.
Now these are the reports. This is one from the report, you know. Yes. As I finish, as I end my presentation, the summary, the world has long recognized the risks associated with work involving handling of biological materials. Regulatory frameworks have been developed at international, regional, national, and institutional levels, articulating the guiding principles that underpin measures taken to minimize these risks. And in this presentation, highlighted on the best regulations and requirements for biorisk management system, isn't it? Using the ISO 35001, so that lab personnel as well as managers can conduct work within a known legal environment. Some references, and then thank you very much for listening to me.
Thank you very much, Dr. Kibuuka. We shall then take questions. However, there was a comment from online that they couldn't hear the audience's engagement. One of the interesting things was that there are only 69 BSL4 labs, 3 in Africa. The 3 in Africa, we have one in Gabon, Cote d'Ivoire, and South Africa. The Arab countries only have one, so we are better in that respect. That was really the point of discussion in the audience. Sorry about that. All right, now we shall take questions and comments for Dr. Kibuuka.
Okay, thank you. I have some questions. The first one is, is it any certification body for biosecurity, biosafety and biosecurity in Africa?
In Africa?
Yes.
Do you have a certification body?
Yes, in Africa CDC we have currently a program called Certification and Training Program. This certification and training program, the aim of this program is to certify the biosafety and biosecurity professionals, and we have 4 levels. The first is beginning, then intermediate, then advanced, then expert. So each level we working to get the list of the along the continent, the expert in the intermediate level, in the advanced level, and the SME level. So this is outcomes of this program. This program is started in Africa CDC in the last April, and implemented the first cohort in South Africa. The first cohort was about the biorisk management, was in the South Africa in the last August. And the next cohort in the middle of the August, about this cohort about the waste management. So we have, as I mentioned, we have 4 levels. We have 4 domains. First one is the biorisk management. Second is the waste management. The third is the facility engineering, and the third is the biosafety cabinet installation, selection, installation, maintenance, etc. So we are prioritize our needs because the resources is limited. I mean the number of employees in the Africa CDC managing this program is limited. So we are only started with the first 2 domains, the biorisk management and the waste management. Regarding the area, as all of you knows, we have 5 areas in our regions in Africa, based on the African Union classification: North, South, East, West, and Center. So why we start with the South Africa? Because the manager of this program decided that this program will not be conducted unless in the what's called regional center of excellence. And Africa CDC are currently working to establish 3 regional center of excellence. The only one is already established now is in the South Africa. So we are looking forward to establish more regional center of excellence, and I hope we can get one in the North Africa. The high potentiality now is in Morocco, and I know that we are trying to engage and motivate other countries, especially Tunisia, to be involved, but there is some problem regarding the Tunisia application. But I think the deadline is tomorrow. Is the deadline for application is end of September. I am certainly sure that Morocco is already applied for regional center of excellence. So I hope we have hosting one in the North Africa. And later on, for the long term or middle term and long term, we will establish regional center of excellence in each region of the Africa. Yes. Thank you.
So we have not yet started, isn't it? It is still work in progress. So I also want to add, but who has been filling up the gap in there? It is, I don't know if you heard about IFBA, the International Federation of Biosafety Associations, that one. It is the one that has been filling up the gap. I recently sat for their exam. I hope I'll pass that one. So, yes.
Regarding IFBA, we are involved with IFBA in our program. And this program also include what's called the ECC, which is the Examination Certification Committee. The ECC is considered as a superior committee responsible for this training program. And the Maureen Elias, which is the CEO of the IFBA, is one of our ECC program. And also Dr. Sekawa also is a member of this committee. So we are considered the IFBA, but the advantage of the Africa CDC program than the IFBA is that we focused on the hands-on training in our program. Thank you.
Okay. So I just wanted to tell him that there's also that window. Before they start, there's IFBA, but you have to pay the dollars to have that. Yes.
Thank you. Okay, I did the IFBA certification too
Yes.
last year.
Yes.
Okay. The other question is, what about certification for ISO, for example, 15190 or 35001? If you elaborate, yes.
That's expensive. Yes.
It's very expensive. Okay.
Basically, the ISO system is is fairly commercial. I think for an institution to go through the whole process will cost you at least $25,000. But the big problem, at least in Africa, you've got the CDC accreditation program. But the big problem is that there tends not to be any internationally recognized accreditation body. Each country generally has to set up its own accreditation body to accredit the institutions that they are in compliance with ISO 35001. And to get to that stage, they need to themselves then accredit the auditors who are actually going to go to the institutions to assess whether they're meeting the standards. So you've got 2 stages before you can start. You've got to set up the national body, your national accreditation body, whatever it's called, has to have an accreditation process which is in compliance with 35001, and then you have to accredit the auditors who are going to accredit the institutions. And those are the steps. I don't know where CDC is with that.
I am on the same page of Dr. Tim about the problem of ISO. We have, I think, not only in our country, I think in all countries depend only on the ISO. The problem of the ISO is, as Tim expressed now, they have national certification or accreditation body. This is national. So this body facing or acquired the problems of the nation. I don't want to talk in details about this. So it is so easy to get the ISO because this is the national. This is our local body. So by somehow you lose the trustability of this. So the impact also will be have very little effect. And this is the ISO accreditation, whatever the number of the ISO, is transferred from their main goals to improve the process, whatever this process and whatever the organization, transferred from this good aim, to just documentary issues for some time, and then before we get inspected, for 1 month before the inspection, we prepare your documents, prepare some conditions, and then get inspected and get approval and return to the normal. So lose the main aim, which is a continual improvement. So I think in USA, not depends on the ISO. They have already the own standards. For Africa CDC, they don't depend on the ISO. They depend on their standards, and they are working on this, either through the legal framework. Even for the legal framework for biosafety and biosecurity, we also give the nation or the country the flexibility to apply according to their local context. But there is a framework they can depend on. Thank you.
Thanks, Robert, for great presentation. I want to comment on this presentation. Now we apply a separate effort for training about application of international regulation. We participate with Robert and Hidayah in a Kibuuka project from Germany to create what's called the simulator case study. How to apply IHR through an imagine case study, not true, but we try to publish this case study to train how to apply international regulation. But I think up till now, there is no obligation for apply international regulation in Africa. Also, this great effort of CDC or external effort. So, what's the solve? How to direct the thinking and effort to apply international regulation and announced, especially under COVID and monkeypox and so on. Thank you.
So I've been working in Pakistan since before ISO was adopted based on the CWA to get organizations there prepared for the ISO. And it's frustrating there because they have the national, it's the Pakistan National Accreditation Council, that exists. But they're going to take a while to get the ISO ready for the national implementation. So I think what institutions can do in the meantime is what I've done with the University of Veterinary and Animal Sciences in Lahore, is to take the ISO, actually in their case because it was before the ISO was published, we took the CWA and we went through the CWA and said, what do we need to put in place in UVAS? And we effectively brought UVAS into compliance on a voluntary, people hate the word self-accrediting because you can't self-accredit, but basically doing everything that's needed under the document, creating the policies, creating the structures, creating the committees, writing the SOPs, recording it all, having the training requirements, having the record keeping for training, all of these things are put in place. And then they have someone else from outside come and audit them. So although it's not officially ISO certified or accredited, they've got to themselves to the stage where when that becomes possible, they're immediately ready to go. So this is something that if you don't want to go through the expense of the ISO process of accreditation as an organization, you can do. You can essentially use the document as a guide to getting to that level.
So, you're not supposed to implement everything within the document to the dot, no? And you know what is going to guide you? It is your risk assessment. What did you come up with? Then you refer to the guiding document of ISO 35001. What do you need to put in place? You see? What do you need to put in place? Then there's that leadership hierarchy, which I showed you. Top management, the senior management, scientific management, and all others. That is the committee now which will sit and then see how they can implement these based on their risk assessment. So it's not really completely that you must do everything. No. It's not really binding. No. Yes.
Yeah, I'd like to build on that point with the ISO 3501. There are two types of accreditation in the ISO system. There are ISOs which are prescriptive. They tell you exactly what you have to do. And then there are ISOs which are descriptive. They are ISOs that tell you what you need to achieve. ISO 35001 is a descriptive one. It doesn't tell you precisely what you need to do. It tells you what you need to achieve. And so it gives you a lot of latitude in how you go about achieving it. But it does clearly lay down, as Robert was saying, that you need to have those roles and responsibilities. You need to have the policy. You need to have the bodies and the structures within your organization to systematically consider these issues and document the entire process, and then to measure and to check that things are being implemented, to correct failures in implementation, and to improve the system continually. So long as you do all those things, how you do it is not prescribed by the document. I'd just like to add one more point, if I may, about the ISO 35001. Robert did a great job of describing the process whereby you do your risk assessment and decide whether risks are at a level that you can accept. I think that the document itself and the approach has one weakness. I wouldn't say failing, weakness, because it fails to address what I talked about yesterday when you don't have the information or you don't have confidence in your information. It assumes you can do a risk assessment. The same algorithm that they have for doing that risk assessment, which I'm happy to share a visual version of that with everyone if you want it, can be readily adapted to the situation where you don't have that certainty. So instead of necessarily going from hazard identification to risk analysis, you can just do the hazard identification where you can't calculate the risk. But that requires that you have something which isn't explicit enough in the document, in my view. And that is you understand your risk profile. What is the risk that you are willing to assume? It's stated implicitly in the document, but it's not explicit enough for my taste. And this becomes particularly important when you're dealing with risks that you can't quantify, the hazards that you know you have but you can't quantify into a risk. Because then when you're faced with that type of hazard, you really, really have to rely on your risk profile. You have to, in HROs they call these never events. What are the events you never want to happen? And how much are you willing to put in the way of resources, time, money, equipment, to avoid those never events? So that's the only thing I want to add. I think that's the only weakness of the ISO, is that it doesn't stress what to do in cases of uncertainty, and it doesn't stress enough that risk profile thing. Thanks, Robert.
Thank you. Oh, your neighbor.
I would like to know what is how the reference lab are distributed in Africa. For example, if our lab can do well the diagnostic of emerging pathogen, for example, for polio, we have exigence to send the sample from Cote d'Ivoire. I would to like to know what is the criteria.
I would like to explain that we already have a framework interesting with what you are saying, what you are talking about. What you are talking about is how the labs handling the high consequence pathogen or toxins. So we have a framework in Africa CDC talking about the regulatory and certification framework for the laboratory handling the high consequence agent and toxins. In this framework, we have checklist. Where is firstly you have standard for the minimum standards for the labs handling the high consequence agent and toxins. Number two, we have checklist for the inspectors who make the inspection of these labs. Third, we already established program for the training the instructors to work on this. So I can share with you this framework. Thank you.
Is that helpful? You've got the answer. Oh, okay.
Africa CDC developed a template for national development of guideline for biosecurity and biosafety. So I don't know from what we show if you use this template. And the second question is if a country has already, guideline for biosafety, but we have discussed it yesterday, that it's mainly on agriculture and the environment, and he want to adopt this one. So we will have two guidelines on biosafety, how to handle this thing.
Yes, I didn't talk about it, but what I know, CDC has already developed the templates, isn't it? Which are going to be cascaded down. I think they have already shared them. So have you started working on that? You have a copy of that? Okay. So I think we are doing some work already along that area. And as far as biosecurity is concerned, the policy. CDC has already taken the lead and is already guiding on that. Yep. Okay. Any other?
Regarding your frameworks, you mentioned that Uganda national registration, our regulatory, sorry, Uganda national regulatory frameworks. You're talking about many frameworks, and I know that you enumerate maybe 2 or 3 in the reference. My question is that all these frameworks is available online or available publicly?
I mentioned some frameworks in my presentation.
Yes. For example, the National Biosecurity Investigation Manual.
Yes. Yes, they are available.
Available online.
Yes, you can look for them. They are available. Okay.
Do we have any comments or questions online? Yes, I see Dr. Fatnasi has a question. You can please unmute and ask.
Hello, everybody. It is, hello, can you hear me?
Yes.
It is just a remark from our institution, which do the risk assessment, biological and chemical risk assessment. I think that we must first start by implementing a risk management system that is complete, from risk detection to evaluation to management to communication, that at all institution level, at our institution level of our respective countries, this process begin with laws, SOPs, trainings, and to make a risk management truly, we have all the system that we have to improve. Thank you.
Thank you for that comment.
Any other question, online or offline? All right, so if we don't have any other question, I would like to thank Dr. Kibuuka for facilitating us wonderfully.